Now let's dive deep into this big LGBTQ story for today. I'm Von Biggs and let's queer up health. LGBTQ patients still turn to ER for mental health, despite more clinic visits. A new study is sounding the alarm on mental health care for LGBTQ folks in rural America. Researchers from the Geisinger Health System analyzed 5 years of patient data and found LGBTQ people, especially transgender and non-binary youth, face staggering rates of depression and suicidality, even though they access outpatient care more often than straight cisgender peers. Many still land in the emergency room for mental health crisis. So let's talk the numbers. Among transgender minors, 59% were diagnosed with major depression, compared to just 12.4% of their non-LGBTQ peers. 8.5% ended up in the ER for suicidal thoughts, 6 times the control group's rate. The study concludes, quote, "These findings suggest that outpatient care may fall short in addressing underlying mental health needs of LGBTQ individuals," end quote. It's not for lack of trying. LGBTQ adults and minors visited outpatient clinics more frequently and sought mental health help at higher rates. Still, the gaps persist, especially in rural areas with few or no LGBTQ affirming providers. The healthcare access and utilization by transgender populations. A United States Transgender Survey study found that 2.8% of transgender people felt their doctor understood their gender-related care, and nearly 1 in 5 said that their doctor knew, quote, "almost nothing," end quote. The solution, experts say, it starts with training providers to deliver affirming care, building inclusive systems, and making gender-affirming services accessible, especially for youth. Because until that happens, too many queer and trans people will continue to face mental health care that feels like crisis control instead of true healing. You know, we talked recently about, the cut of Pound 3 from the crisis hotline that, our LGBTQ youth does not have access to any longer. And we've always talked about how the LGBT community suffers when it comes to mental health issues. But this new study is a wake-up call. Despite more LGBTQ folks, especially youth, seeking help, the system is still failing them. And when outpatient care doesn't meet their needs, the ER becomes the last resort. That's not mental health care, that's damage control. The numbers speak volumes. Let's pause on that stat. 59% of transgender minors are diagnosed with major depression. That's nearly 5 times the rate of their non-LGBTQ peers. And ER visits for suicidal thoughts, 6 times higher. These aren't just numbers, they're lives, and they're telling us something urgent. So we've got to fix this.
I mean, speaking from personal experience, the ER was the only thing that I thought I could go to because I didn't have the support at home, and I knew my doctor didn't understand. And so off to the ER. And I was in a major city. To somebody who's in a rural community who definitely probably doesn't have the support at home, who doesn't probably have a doctor that understands them, especially transgender issues. The ER, unfortunately, in this case, seems like the only help. And, if that is, unfortunately, the only help they have at the moment, I'm glad that they're taking it. But I do agree, not only do doctors and healthcare people in general need to have more education. It's simple as I lived in Delaware, where you would think, it's a pretty LGBT friendly place, and it's one of the beach towns. But my care provider there, when they asked what medication you're on, and I said Truvada, they're like, "What's that?" And the pharmacist is like, "Why are we selling so much of this?" I'm like, "Do you not know what you're selling?" So that right there was the day that I paused, going, okay, well, if they don't understand the simple thing as PrEP and Truvada, then how are they going to understand, mental health needs for not only myself, but trans people, non-binary people, because they don't have the education, or they don't listen to their education.
First off, thank you for shaking my faith in the medical community. If you don't even know what Truvada, even I know that.
Unfortunately, it's true.
I guess the other thing that scares me with these stats, because these are all scary stats,
right.
People also go to the ER for health issues when they don't have access to health insurance, whether their insurance doesn't provide enough insurance or they don't have it. So if you're seeing a spike of people going to the ER for mental health, it could be that they don't have access to insurance as
Also
well. Like,
true.
because like, and people are like, oh, well, didn't we pass laws that cover this? I personally, it was a mental health medication of mine, and when I lived in Rhode Island, I was trying to get access to, and the insurance didn't want to pay for it, and I had to call a health advocate. I'm like, what's going on? And like, oh, well, your insurance doesn't provide enough coverage to actually for those laws to apply. I'm like, what do you mean? You're saying my insurance is so crappy, I'm now exempt from basic laws. So you see that sort of example of like, oh, I had to pay that out of pocket. I could afford to pay it out of pocket, but I would just imagine all sorts of kids and adults with mental health issues that don't have access to health care, whether it be the insurance or the insurance doesn't cover it, and are going to the ER to deal with it. And then, dealing with doctors in general, and if you're queer, has always been bad. I can only imagine what it is for trans people. Less than 3% think their doctors understand. It's just, that probably frightens me more than any other stat in this.
Well, and you bring up, I have good health care, yet my health care doesn't pay for my mental health services that I use to this day. So, and it took me actually calling and trying to figure out. So there's story is, there's a lot of levels to this. Most people who have healthcare don't understand the insurance that they do have because they don't have proper people at their works giving them the proper information. HR is going, here's your healthcare. And then it takes, sometimes dialing 20 different numbers to figure out, hey, what am I covered? I find that sometimes health providers, it's very hard to get information out of them going, hey, can you help me understand what is covered and what is not? And then to find out that your healthcare is, you have healthcare, you're paying for it, but then it doesn't cover mental health services. If you have healthcare. And so to double compound that, you're talking rural people, you're talking youth. So youth people aren't going to have healthcare. They're typically on their parents' healthcare. And how many of you, when you were a child, said, hey, mom and dad, what does my healthcare right? What does your health care cover on me? We didn't, because mom and dad took care of it, right? Yeah. So now you're in a situation where you can't talk to your parents about being LGBT. You can't talk to them about what your health care is covering. So, there's a lot of apps and websites that are starting to pop up that are, specifically made for LGBT healthcare, and which is great. And so, hopefully some of the younger people who are very tech savvy are starting to stumble across this. And, this is saying that they are looking for healthcare. Mm-hmm. But unfortunately, when you don't have the tools. One
thing you brought up, I just want to take a moment to think about the insanity of a child being expected to understand what their insurance doesn't cover.
I know.
That's just crazy to me to think of. I know that you didn't mean it like that, but I know that in our country, the way we're dealing with healthcare right now, we expect children to be experts in insurance payment systems.
Well, they expect adults to be too. Think about it. They go through and people keep the same insurance, plan. You think Medicare, and they go, I'm keeping the same plan, but they don't realize in that same plan that there were changes when the new year rolled around, and they don't know what they lost because.
Yeah, exactly.
Yeah. Well, that is a big LGBTQ story for today. There is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by subscribing and sharing Queer News Tonight.